What foods can I eat to lower my risk of prostate cancer? Men who are worried about their prostate health frequently ask doctors questions like this one. No doubt many look to their doctor to recite a list of foods that will protect them from illness. For the time being at least, there is insufficient evidence to support the associations between certain foods and a lower risk of prostate cancer. A portion of the fluid that carries sperm during ejaculation is produced by the prostate gland. The channel that the pee exits the body through, the urethra, is surrounded by the prostate gland. Growing older increases the risk of benign prostatic hyperplasia, BPH, also known as an enlarged prostate. Half of the men will exhibit symptoms of benign prostatic hyperplasia by the age of 50. Nonetheless, you may be able to control BPH symptoms like increased frequency and urgency of urination by adopting some sensible dietary and exercise adjustments. Do you often feel the need to urinate, or do you ever get the sudden need to urinate, especially at night? Are you urinating infrequently? Do you feel any pain when you urinate? Do you feel as though your bladder isn't emptying all the way? Do you have a loss of bladder control? What about low libido or weak sexual performance? In the world, 50% of men over 40 have had or will experience a prostate problem at some point in their lives. And as our consumption of junk food rises, so does that number. Men in their 40s, 50s, 60s, or 70s have a greater than even chance of having an enlarged prostate gland, which can cause a variety of symptoms such as a weak urine stream, leaking urine, blood in the urine, difficulty starting to urinate, dribbling urine, frequent urination, and occasionally an unexpected urge to urinate, especially at night. More severe symptoms include fever, nausea, back discomfort, and blockage in the urine. Prostate enlargement is the second leading cause of death for males in Africa and reaches nearly epidemic proportions in our contemporary society. Some say the risk can be managed, but researchers have proven otherwise. A man's capacity to urinate and frequently perform sexual functions is impacted when his prostate gland enlarges and presses against the urethra, sometimes known as the waterworks tube. As a result, a large number of men have erectile dysfunction, and some may face the additional stigma of incontinence, uncontrollably wetting. There may be catastrophic psychological repercussions with several potentially dangerous adverse effects, including decreased sex drive, retrograde ejaculation, and impotence, which are frequently nearly as problematic as the prostate illness itself. The most frequent cause of an enlarged prostate is age-related issues. Men often have more testosterone and lower estrogen levels as they get older. An enlarged prostate may result from this change in hormone balance. Furthermore, a genetic propensity to develop BPH may exist in some men. Prostate enlargement is more likely to recur in men who have already had it. Obesity and a family history of prostate problems are other risk factors. Dietitians, doctors, and researchers advocate for a general pattern of healthy eating rather than concentrating on particular items. It's surprising how simple good eating may be. In summary, this is what professionals advise. Consume 5 or more servings of fruits and vegetables each day. Select the ones with vivid, deep shades. Select whole grain pasta and cereals, and opt for whole grain bread rather than white bread. Limit the amount of red meat you eat, such as goat, lamb, and hog, as well as processed meats like hot dogs and bologna. More nutritious sources of protein include fish, skinless chicken, beans, and eggs. Go for healthy fats like avocados, walnuts, pecans, and olive oil. Limit your intake of dairy and other animal products' saturated fats. Steer clear of trans fats, which are partially hydrogenated and found in a lot of packaged and fast food items. Steer clear of beverages with added sugar, like soda and most fruit juices. Consume sweets just occasionally as a treat. Reduce your intake of salt. Examine and compare food labels to select low-sodium options. The use of frozen, processed, and canned meals should be minimized. Keep an eye on serving portions. Eat mindfully and stop when you're satisfied. You should maintain an active lifestyle in addition to consuming a nutritious diet. Frequent exercise improves health and reduces human chance of dying from heart disease, stroke, and some cancers. Most researchers have found that exercise is beneficial, even if not many studies have specifically examined the effect of exercise on prostate health. Researchers discovered an inverse link between BPH symptoms and physical activity based on questionnaires filled out by over 30,000 men in the health professionals' follow-up study. Put simply, men with higher levels of physical activity, such as walking frequently at a moderate speed. Researchers also looked at the connection between erectile dysfunction, ED, and exercise using information from the health professionals' follow-up study. Researchers discovered that males who engaged in 3 hours of intense outdoor labor or an hour and a half of running per week had a 20% lower risk of developing ED compared to those who did not exercise at all. The advantage increased with more physical exercise. Interestingly, men with an optimal body mass index, or BMI, were less likely to develop ED than men who were overweight or obese, independent of their degree of exercise. For 18 weeks, 231 inactive males with chronic prostatitis were randomly allocated to one of 2 fitness regimens: aerobic activity, which comprised brisk walking, or non-aerobic exercise, which included leg lifts, sit-ups, and stretching. Every group engaged in 3 sessions of physical activity every week. Men in both groups felt better at the end of the study, but the group that engaged in aerobic activity reported much less discomfort, anxiety, and depression, as well as an improvement in quality of life. Medical attention is not always necessary for BPH. Your doctor may occasionally recommend routine exams to track the enlargement of your prostate and your symptoms. Treatment options for symptoms that are lowering your quality of life include medication, surgery, and lifestyle modifications. Together, you and your medical provider will create a treatment plan that will enable you to control your symptoms and lead a healthy life. You can reduce your BPH symptoms naturally by adopting certain lifestyle modifications or taking specific steps. They include urinating as soon as you feel the need, using the restroom even when you don't feel the need, avoiding over-the-counter decongestants or antihistamine medications, which can make it more difficult for the bladder to empty, abstaining from alcohol and caffeine, especially in the hours after dinner, lowering your stress level because anxiety can increase the frequency of urination, exercising frequently because inactivity can exacerbate symptoms, becoming knowledgeable about and skilled in Kegel exercises to strengthen your pelvic muscles, staying warm because being cold can exacerbate symptoms. In addition, some individuals manage BPH using natural therapies. Nevertheless, there's no proof to support their effectiveness. Keep in mind that your health is our utmost priority, and we're committed to providing you with essential health tips so you may lead a happy and healthy life. Hit the bell to subscribe and stay up to date with our exciting videos. Feel free to share your thoughts and opinions in the comment section below. Thanks for watching.